Well, good morning, and thank you for joining us. Listen, medicine is constantly evolving. It's constantly changing. Things are coming in, things are going out. New technologies are being born every single day. Today, we're not talking about something that's new. We're talking about something that's been around for a very long time. We're talking about hyperbaric medicine, and we have Dr. Tyler Sexton with Coastal HYPERBARX. Dr. Sexton, how are you this morning?
I'm good, sir. How are you? Thanks for having me on.
I'm well. Thanks for being with us. So tell us, what is hyperbaric oxygen therapy?
Absolutely. So hyperbaric oxygen therapy is when you use a special chamber called a hyperbaric chamber in which we put the patient under pressure and they breathe oxygen, and that oxygen goes into the tissues through a variety of different physics applications, Henry's and Dalton's law, and it forces its way into the tissues and provides dramatic healing effects in wound care, in cancer diagnoses, and beyond. It's a fantastic therapy.
So how long? I know that this is I've spoken with your partner about this a few times. How long have you guys been involved in this hyperbaric medicine?
Absolutely. So I've been doing hyperbaric medicine for 25 years. I'm the president of the American College of Hyperbaric Medicine. I hold a master's designation in wound care and hyperbaric medicine with the American Professional Wound Care Association, and have a qualification in hyperbaric medicine with the American Board of Wound Healing. So we've been doing this a long time. We're so excited to bring this therapy to the Gulf Coast that makes it unique. There are hyperbaric medicine has been around for a long time, but this is the only multi-place facility of its kind on the Mississippi Gulf Coast. It's a modular multi-place 3-seat chamber, FDA 510K cleared, ASME cleared, and PVHO. So this is what you would see hospital grade with the best technology met with the best clinical outcomes to give you dramatic healing potential. And we're so excited to do that for this coast.
Yeah, we're seeing some of that here on the screen now. I'll tell you, when I first had this conversation, I immediately go back, like many people probably do, immediately go back to that image of Michael Jackson in the hyperbaric chamber. This is not that. This is such a step up, a major upgrade from that. I'm glad you mentioned wound care. How does this work together with wound care rather than replacing it?
Absolutely. Great question. One, you made the jest about, Michael Jackson. You're absolutely right. There's been a lot of bastardization of the industry, and we're the highest quality, safety wise. And the way it works with wound care is it augments, it is a critical adjunct. You can't build a house with just a hammer. You need the tools. Well, hyperbaric oxygen therapy allows the tissues to be better demarcated for the surgeon or for the doctor to debride. It will kill bacteria and reinvigorate and heal bones that are infected from chronic bone infections called osteomyelitis. And if you're a diabetic and you've had a wound for years, if a wound can't heal past 30 days and somebody is telling you you need an amputation, please come see us first. We can reduce amputations by 75 to 80% when you add hyperbaric medicine to the regimen of healing. And we specialize and partner with some incredible wound care facilities to bring that tool of hyperbaric medicine in their toolbox to bring dramatic healing and saving limbs. Because if you save a limb, you save a life. If somebody has an amputation, they have an increased risk of morbidity and mortality, even that higher than cancer. We want people to stay walking, stay limber, and stay moving. And hyperbaric medicine can save these limbs and change people's lives.
Well, I'm glad you mentioned amputation. That is a specific kind of patient that you have been very successful in treating. What are some of those other medical conditions that can benefit from this hyperbaric oxygen therapy?
Great question. So they're approved. There's about 15 approved indications in hyperbaric oxygen therapy. The ones we see most commonly is diabetic foot ulcers, like we said. We also have some thermal burns, compromised grafts and flaps if you had reconstruction surgery of any kind. Also, cancer diagnosis if you have radiation injury to the bladder, or to if you're bleeding when you urinate. If you're a male or a female, males have a lot of prostate cancer radiation, and then issues with that afterwards. Also, any sort of squamous cell carcinoma or mouth and tongue and facial cancers if you have radiation necrosis of any kind. Also, other problem wounds, carbon monoxide poisonings, just to name a few. And then also traumatic brain injury. There's been some improvements there, and some concussion syndromes. We can treat anything, the FDA approved indications, and some great off-label ones that do dramatic improvements, like your concussions, TBIs, autisms, just to name a few. It is a dramatic and impressive therapy, but our most common treatments are going to be chronic osteomyelitis or bone infections, and then your diabetic foot ulcers, and then your cancer treatments, and osteoarthritis necrosis of the jaw, or any sort of wound that can't heal because you've been radiated. When you have radiation tissue, wounds stay there for a long time, and we can regrow blood vessels. That's what hyperbaric medicine can do. It regrows blood vessels to the area and bring dramatic healing and new healing tissue to the area.
So you're not. I guess a good question, a good observation for me, I think, is that you're working alongside of some of these treatments, specifically where cancer is concerned, because everybody we talk to is somehow touched by this horrible disease, and so people who are getting those radiation treatments are coming to you to heal faster after those treatments. Correct?
That is correct, sir. And when you do that, you can heal faster, up to 90% faster. You also will heal and feel better, right? It's the best anti-inflammatory, better than any steroid out there, and it's one of the safest. It also is going to heal those wounds, help with all the side effects that goes along with those radiation injuries. There's some inclusion criteria that when you come to our office, we can share with you. I've been on the Mississippi Gulf Coast for over 10 years, my partner and I, Dr. Bowen, and it's just been an honor to serve this area. And you'll learn about that when you come and see us. But cancer and avoiding some of those side effects that brings, the cancer treatments. My mom has stage 4 colon cancer. I've lived it. I've been there. And I have cerebral palsy. I was told I'd never walk, talk, or be a doctor, which gives me passion for this medicine and for its people. But I know what the ravages of cancer and radiation does to a body. And hyperbaric medicine can reclaim part of your life that you needed that radiation treatment. You needed that cancer treatment, but it will bring back a lot of that, and it will bring back healing much, much faster. And it's critical.
Dr. Sexton, we have about a minute left. Tell us what is a common misconception that you hear about hyperbaric therapy?
One of the most commons is that any chamber is the same. That is not correct. This is a hard shell, and you must breathe oxygen, 100% oxygen, medical grade, and this is what's critical. And our chamber is the best in the business in that is an ASME 510K cleared, and not all hyperbaric medicine is the same, nor is everyone trained the same. We are trained by the American College of Hyperbaric Medicine, and all of our technicians are trained in that way respect. So you're getting one of the best. You're getting quality care along with exceptional education, with exceptional technology, and you're going to get the best clinical outcomes at Coastal HYPERBARX.
I imagine your patients are thrilled after their treatments.
They are. It is it's a family environment, right? They're going to be a place where there's no hope, right? They've been told this can't be done. We are a place that gives them hope and gives them real results to recapture or reclaim their lives, which is really special.
Listen, I just, having talked with Dr. Bowen and now yourself, like I'm very interested. It's something that's kind of foreign to me, but has been around for so long. If you have any questions, you see that number, you see that website there at the bottom of your screen, give Dr. Bowen, Dr. Sexton a call. Ask all the questions you can possibly ask. They're there to help you get back on the path. If you're going through cancer treatment and you need healing, any other conditions you have that need quick, fast healing so that you can get back on your journey, give them a call and they'd be willing to help you. Dr. Sexton, thanks so much for being here with us today.
Thank you, sir. Have a great day.